will call this meeting to order. Good afternoon, everyone, and welcome to our first meeting of the Assembly Committee on Health and Human Services for the 81st Legislative Session. Madam Secretary, can you please call the roll?
Assemblywoman Benitez Thompson.
Here.
Assemblywoman Black. I know she's here, I see her. Assemblywoman Gorlow.
Here.
Assemblyman Hafen.
Here.
Assemblywoman Krasner.
Here.
Assemblyman Matthews.
Here.
Assemblyman Orentlicker.
Here.
Assemblywoman Peters.
Here.
Assemblywoman Summers Armstrong.
Here.
Assemblywoman Thomas.
Here.
Assemblywoman Titus.
Here.
Chair Wynne.
Here. And it looks like everyone is present, Madam Secretary. Thank you. And I saw Assemblywoman Black saying yes, are present. So just if that it wasn't already marked for the record, if we could just indicate that as much. But thank you everyone for joining us, and thank you to our virtual audience watching this online on their phones or any other device that they have available to them. I'm just going to kind of jump into this. Today we have some introductions, adoption of committee policies, and some presentation by the staff in the Department of Health and Human Services. I just want to kind of kick it off. And before I begin, I'd just like to make several housekeeping kind of announcements. For those of you that don't know, the Assembly Committee on Health and Human Services is scheduled to meet Monday, Wednesdays, and Fridays at 1:30 p.m. For those of you that are returning, know that sometimes floor can go a little bit longer, so that's a moving 1:30, but I will plan on trying to start on time all the time. So I'd ask people to kind of get on early, especially in this virtual setting, because we always have some difficulties, including myself. And unfortunately, my 10-year-old son, who's usually my house IT person, is not here up in Carson City, so he won't be able to run around, although I know we have great staff here with LCB. This is a virtual meeting format, so it's obviously meant to keep us safe during the COVID-19 pandemic, but I also see it as an opportunity for members of the public to provide testimony in a variety of different ways that they haven't been able to in the past, and hopefully even moving forward as we eventually move to a situation where we are meeting in person and taking testimony in person, that we will still allow some of the public to participate in those new ways that we have developed around COVID-19 protocols. In addition to all of this, any written documentation, committee exhibits can be viewed electronically. And you can also email Abigail Lee, our committee manager, by noon the day before the meeting if you would like to submit anything in writing. And I would ask all committee members to please keep your cameras on unless you need to step away from this meeting. And if you do so, if you could just let either myself or Vice Chair Peters know, that would be greatly appreciated. So without further ado, I'm going to kind of move to the next. Last thing. Just so we have an orderly flow of discussion, if you have comments or questions or responses, if you can have it come through myself. I know we've been utilizing, there's multiple different ways that we can communicate. I think probably the easiest that I've found in other committees is if you want to send a message to me via Skype, and I will recognize you before you can speak. If you can raise your hand if you are having difficulty on Skype, I know we will try to be as flexible as possible. And I know Vice Chair Peters will also be kind of looking out to see if people are motioning that they have a comment or they'd like to say something. So we will move on to the next thing. I'm going to just start with some committee members and staff introductions. And I'm going to start with members of the committee and the committee staff. If you guys can introduce yourself, I know you've done this a lot lately, so, and some of you already know each other, but there's always that committee where you've never been on a committee with someone. And so if you could briefly introduce yourself, that would be great. And I'm going to start with my friend and Vice Chair, Assemblywoman Peters.
Thank you, Chair. I'm really looking forward to serving on this committee, particularly with Assemblywoman Nguyen as chair. I think this is going to be a really great session to talk about issues that come in through HHS. So thank you so much.
Thank you. And if I can move next to Majority Leader Teresa Benitez Thompson.
Hello, I'm Assemblywoman Benitez Thompson. I'm very excited to be returning to the Health and Human Service Committee. I served on it for all of my sessions except for last session, and am happy to be back here, one of my favorite subject matters.
And if I could move to Minority Leader Robin Titus.
Thank you, Madam Chair. Excited to see that you are the chair of this committee and your passion for all Nevadans. That's exciting. I'm Dr. Robin Titus. I'm a family physician, 35 plus years of family practice in the office, in anything that went through my door. Lots of ER experience, also long-term care medical director. I gave up those hats, however, so that I could be here. The only thing that I'm doing medically currently is I'm still the Lyon County Health Officer. So I do have lots of experience in healthcare realm. I represent rural Nevada also, District 38. So a lot of the rural healthcare issues have been a passion for mine. And I look forward to solving problems in healthcare access throughout this state, not just in rural, but in urban settings. And I think healthcare has always been something that has a wide range of bipartisan support for it, because I think there's not a person on this committee that doesn't recognize that healthcare is critical to the state, all Nevadans, regardless of where you are. So I'm excited about the makeup of this committee. I'm excited to be back. This will be my fourth time on it. And I just look forward to solving some of the much needed issues here in the state of Nevada regarding healthcare. So looking forward to conversation.
Thank you. And I'm going to go next to Assemblyman Gregory Haven.
Thank you, Madam Chair. Gregory Haven II, District 36, second session on the Health and Human Service Committee. And agree with what everybody else just said. Excited to be here. A lot of hard work ahead of us. Yeah, that's all I got.
And we have another returning member, Assemblywoman Michelle Gorlow.
Hi, thank you, Chair Nguyen. Assemblywoman Michelle Gorlow. I represent Assembly District 35, which is in the southwest of Las Vegas. In my day job, I work for a local nonprofit organization that provides healthcare to children, and we emphasize children with special healthcare needs. Prior to that, I'd worked with maternal child healthcare issues, and so healthcare has been very near and dear to my heart for the majority of my career. I'm really excited to be serving my second session on Health and Human Services, and look forward to continuing our hard work that we had during the interim and also last session. So thank you.
And we also have returning member, Assemblywoman Lisa Krasner.
Thank you, Chair Nguyen. It is a pleasure to be here with all of you. I am Assemblywoman Lisa Krasner. I represent Nevada State Assembly District 26, which is South Reno and Incline Village. I did serve on HHS in the 2019 legislative session, and I'm very happy to be back again. Looking forward to creating legislation that helps the people in the state of Nevada and improves their lives. Thank you.
And if we can go to Assemblyman David Ornlicker.
Thank you, Madam Chair. David Ornlicker, Assembly District 20, which is on the east side of Las Vegas and Paradise and into Northwest Henderson. My background's in medicine and law. I teach at UNLV School of Law, also medicine, health law, constitutional law. So I've spent a good part of the past several years thinking about how we can improve our healthcare system. My first time on this Health and Human Services Committee, but I served 6 years on the Public Health Committee, the equivalent in the Indiana legislature about 15 years ago, and looking forward to working with everyone.
Thank you. And if we can go next to our another new member, Assemblywoman Chandra Armstrong.
Good afternoon, everyone. I have folks in the office, so excuse the mask. My name is Chandra Summers Armstrong. I am the Assemblywoman for Assembly District 6. We just had a little technical problems, but the crack IT team has come through. So happy to be here. Excited to help in any way I can to advance good policy that will assist the folks in my community and all across the state of Nevada. Thank you so much.
Thank you. And next, Assemblywoman Claire Thomas, can you introduce yourself?
Thank you, Madam Chair. I'm Claire Thomas, Assembly woman for Assembly District 17 in beautiful North Las Vegas, which is about 5 miles west of Nellis Air Force Base. I am a retired Air Force veteran, and I am extremely happy to be on this committee. Look forward to good bills coming out and addressing some of the issues for our vets, our elders, and our community in general in the state of Nevada. So thank you so much for being on this committee.
Thank you. And if we can go to Assemblywoman Annie Black. Broadcast services, do we know if we can get a little bit of help? I don't know if anyone else can hear her.
Hello, this is BPS. Assemblywoman Black, if you could go down into the bottom left hand of your screen where you see the mute, there's a little caret. And if you could toggle between the microphone and same as system, it usually will readjust itself for you.
Is that better?
Yes, that is great. Thank you so much. You're doing great.
Okay, Annie Black, Assembly District 19. I am a realtor, but I'm married to a medical professional, a neurophysiologist. We've just started a little medical business. Hopefully it'll be a big medical business someday, but I'm curious and interested to see about some of the stuff we're going to talk about in this committee, and hope that I can bring some good feedback to the group.
And last but not least, can I have Assemblyman Andy Matthews introduce yourself?
Thank you, Madam Chair. Andy Matthews. I represent Assembly District 37, which is in northwestern part of the city of Las Vegas. This is my first legislative session. It's an honor to be here. I look forward to serving with all of you and working on this very important issue area. Thank you so much.
Thank you. And this is my second session on HHS, my second legislative session as well, and it is my first as chair of this committee, a role that I'm truly humbled and honored to serve in during this session. However, the role I'm probably most proud of is mother to my two beautiful children, my sweet, way too smart for his own good 10-year-old son, Henry, as well as my wild and crazy and sarcastic 8-year-old daughter, Hannah. And anyone that's met her knows that this is very much true. I should probably list my other children, my husband, he's wonderfully supportive, my father, Tung, and my father-in-law, Dale, and of course, our COVID puppy, Neil. After Neil Young, I know that Assemblywoman Titus had indicated that she had seen Neil Young, so she will probably appreciate the name. But it is this multi-generational living that I grew up with in my house and that I now have in my house. It may sometimes feel like a reality show, but it's kind of what I bring to the HHS committee is that we all have these challenges that we face in the area of healthcare, whether it's access. I'm dealing with it, personally with my children, with my elderly parents. And so I know that there are a lot of policies that we all care about that hopefully we can pass here that will affect families like our own. So, and with all the unique challenges that the last year has brought, I'm still just always inspired by the fighting spirit that Nevadans have. It's what kept me here when I moved here in 1999 and why I haven't left. So we would not be able to be here without the amazing staff that we have here in HHS. And I'm going to introduce them. And if they are on here, and I'm not sure if they are actually on here, if they can kind of unmute themselves and maybe say hi, but I will do a little introduction for them because I know they're a little shy. But we have Abigail Lee. She goes by Gail Lee, and she is our committee manager for HHS. She was born and raised and educated in the Philippines and has a bachelor's degree in business administration. Before working in the Assembly, she lived in the Washington, D.C. area and worked in the private sector, most recently as a business operations manager at a Fortune 500 company for over 10 years. She's also held leadership roles in aviation and the hospitality industry and moved to Carson City in 2019. She is the mother of 2 boys, David 8, Daniel 6, and outside of work, she spends a lot of time volunteering, volunteer duties, loves hiking, snorkeling, running, and has a passion for performing arts. And today we wore the same shoes. So if she is on here, if you could just unmute yourself and maybe say hi, that would be great. I know sometimes if we can put a face to the name, that's great. But I don't see her on here, but.
Good afternoon. It's good to be
There
here.
she is. Thank you. And if we could also welcome Terry Horgan, our committee secretary. She has lived in Carson City since 1975, is a retired bookkeeper, and has worked as a committee secretary for many legislative sessions, primarily in health and human services. And she tells me that she loves her job, and there's multiple exclamation points. So if she is on here, if we can have her unmute and kind of say hi, that would be great as well.
Hello, everyone.
And then I want to introduce everyone, because if you are trying to get a hold of me or you want to have a meeting with me, or you just want to come see my record collection with your mask on, my attaché, my personal attaché is CL Talada. She is a proud Nevada native, a UNLV graduate. During the 2019 legislative session, she worked as a legislative intern in the Assembly Leadership Office, and she most recently graduated from UNLV with her Bachelor of Arts in Political Science, and she is currently working on her Master's of Public Administration degree, also at UNLV's School of Public Policy and Leadership. So she will sometimes be here late at night doing her classes online. Prior to the start of the 81st session, she has worked on 2 presidential campaigns and served on 2 executive boards, including the Nevada Young Democrats as the Director of Expansion and the second Vice Chair for the Asian American Pacific Islander Democratic Caucus. She is also helping with our nonpartisan AAPI Legislative Caucus this year with some of the cultural events that we have planned, probably in a virtual setting. So if I can have her, I don't know if she's on here, but if I can have her pop on, I don't think she is, but you will see her. And we are twinning today, which is very strange. Trinity Tom is the Committee Assistant for Health and Human Services, Growth and Infrastructure, and Legislative Operations, and Elections, and Natural Resources. This is her 4th legislative session and 2nd time on HHS. And she is an enrolled member of the Walker River Paiute tribe. And she enjoys traveling and playing softball in her free time. And I don't know if I saw her on here as well, but if she is and you want to unmute yourself, great. No, let's see. And next I will go to some of our nonpartisan committee council. And I will start with Miss Carly O'Krent. And I will let her introduce herself.
Hi, thank you, Chair. My name is Carly O'Krent, and I'm an attorney with the legal division of LCB, so I'll be your committee counsel for this committee. This is my 5th legislative session, on my 2nd session staffing HHS. In years prior to that, I staffed the Education Committee. And most of you are familiar with the services that Committee Counsel offers, but in the event that you're not, I'll be helping with answering questions regarding bills the committee is hearing. I'm happy to answer questions offline as well. And I can also help with preparing any kind of conceptual amendments or mock-ups as those arise.
Thank you, Carly. And then finally, I'm going to let Patrick Ashton also, he's our committee policy analyst, and I will allow him to introduce himself as well.
Thank you so much, Chair Wynn, and good afternoon. I'm Patrick Ashton, and I work as a senior policy analyst with the research division of the Legislative Council Bureau. So this is my second session with the legislature. Last session, I staffed the Assembly of Commerce and Labor. And during the past interim, I staffed the Legislative Committee on Healthcare for some meetings and the Committee to study the cost of prescription drugs. Some background about myself. I hold 2 master's degrees from UNR, one in political science, the other one in social work. I'm also a licensed social worker and worked for the Aging and Disability Services Division at DHHS and the University Center for Autism and Neurodevelopment at UNR before joining LCB. And by now you may have noticed my accent. I'm originally from Munich, Bavaria in Germany, and since 2009, I have enjoyed living in Nevada for most of the time. I'm really honored to serve as your committee policy analyst, and I'm looking forward to working with all of you. Thank you.
Thank you, Patrick. And this goes for all the committee members. I think it was one of those things I didn't realize how valuable and what a resource those 2 individuals in particular are for all members on this committee. So please reach out to them, as you're looking through bills. If you have questions about them, they are there to help all of us on this committee kind of understand and unpackage and get through sometimes the very complex nature of looking through these BDRs as we're going through the session. So please take advantage of their resources and their knowledge, and they're fantastic people as well. Our first order of business today is the adoption of the committee policies. They were posted on the legislature's website, and I believe we have the opportunity to also email them. They are policies that I'm sure you have all already voted on. They're very similar to those approved in other committees. They are to serve as a complement to the Assembly standing rules and the joint standing rules that we adopted as a legislative body on Monday in the full Assembly. And due to the virtual format of some of our meetings, and some additional virtual meeting policies have been added. And I hopefully everybody's had an opportunity to do that. And if there are any questions or comments that people have regarding those policies, if you want to let me know, that would be great. I'm kind of looking around here. I don't see anyone. So I will entertain a motion at this time to adopt the committee policies for the Assembly Committee on Health and Human Services.
So moved. I'll second it.
Okay. Who moved?
Sarah.
A motion by Vice Chair Peters and a second by Assemblywoman Titus. And for this motion, I will take a roll call vote just for precision and simplicity. So if you can vote either yes or no for when your name is called. So if I can ask Madam Secretary to please commence a roll call vote.
Assemblywoman Benitez Thompson.
Yes.
Assemblywoman Black.
Yes.
Assemblywoman Gorlow.
Yes.
Assemblyman Hafen.
Yes.
Assemblywoman Krasner.
Yes.
Assemblyman Matthews.
Yes.
Assemblyman Orentlicker.
Yes.
Assemblywoman Peters.
Yes.
Assemblywoman Summers Armstrong.
Yes.
Assemblywoman Thomas.
Yes.
Assemblywoman Titus.
Yes.
Chair Wynn.
Yes. And so that motion carries unanimously. Thank you guys all. I'm very excited about this. This was also on Nellis and probably provided in an email. But next I'm going to have our committee policy analyst, Patrick Ashton, present the committee policy brief. And if you want further details about what is contained in that, like I said, it is a larger document that was already previously provided if you haven't had the opportunity to review it yet. So I will turn this over to Patrick.
Thank you so much, Chair Wynn. For the record, Patrick Ashton, Committee Policy Analyst with the Legislative Council Bureau. Before I start, a little reminder, as legislative staff, I cannot advocate or oppose any of the proposals that come before you. I'm here to assist the chair and the members with any questions concerning policies that may arise. My only agenda is to be objective and provide you with unbiased information. And I'm available to assist the committee and its members on any issues related to health and human services. In addition, the research division is available to provide information and assistance on a confidential basis to individual members of the legislature on any topic. So please feel free to reach out to me or any of my colleagues at any time. So you have all been provided an electronic copy of the committee brief, and you can also find a copy on Analyst. This brief provides background information on the work of the committee and policy issues that you may consider this session. I'd just like to take a couple of minutes to cover some highlights. So let's go first to page 1 of the committee brief. And during the 2019 legislative session, this committee considered a total of 46 Assembly and 41 Senate bills and resolutions, which is a total of 87 measures. 74 of these were voted out of the committee, and the legislature approved 68 measures. That means of the original 87 measures, over 3/4 of them were signed into law. So it appears this committee was quite busy last session. Let's see what may happen this session. So please turn now in your committee brief to page 2 to 5. For the next 4 months, we can expect hearings about many health and human services issues, either in this committee, in Ways and Means, or on the floor. The pandemic caused by the coronavirus disease of 2019, COVID-19, will dominate any measures that you will consider this session, either directly or indirectly. So for example, you may consider measures related to public health, behavioral health and substance use, access to healthcare, and prescription drug costs, just to highlight a few of them. The committee brief provides background information on these highlights. We will also hear additional presentations from experts on public health, mental health, and Medicaid in the next couple of weeks. Just one quick note, in the brief, I made a mistake on page 3 under the behavioral health and substance use section. The first sentence of the section stated that more than 1/4 of adults in Nevada have a mental health disorder, and this is incorrect. Instead, it should say more than 1/5 of adults, 20.7% to be exact, have a mental health disorder. I corrected this error, and you find the updated committee brief uploaded on the committee's webpage, and I apologize for my mistake. Next, on pages 6 and 7, you will find an overview of relevant audits, reports, and studies, such as interim committee bulletins that summarize the work of committees and studies during the past interim, reports on certain issues that the Legislative Committee on Healthcare studied, and legislative audits from the LCB Audit Division. The committee brief contains hyperlinks to the audits, reports, and bulletins if you like to dig deeper in certain issues. Finally, you will find a separate document in your meeting materials that lists relevant state or local agency contacts. The agencies included are those that are likely to come before the committee at some point during session. Madam Chair, this concludes my presentation, and I'd welcome any questions you may have.
Does anyone have any questions for Patrick at this time? I don't see anything there. Like I said, he is an invaluable resource to the committee. He is there to answer all of your questions in a just straightforward way, and it's been fantastic. So I appreciate all of his help in getting ready for today, and I look forward to working with him the rest of the session, as I'm sure all of you will also have a great love of Patrick and everything he can do for you on this committee as well. And with that, we are going to move into our first and only presentation today. And I asked Director Whitley to come and present just a very broad overview of the Department of Health and Human Services. I will tell you, I came to this committee last session and even into this session, just learning new things about what DHHS does for our state. For those of you that are aware, a tremendous amount of our state budget is healthcare related, and I can't even begin to describe the scope of what this department in our state does. And we have a wonderful director, Whitley, that manages all this. I don't know how he does it. He's incredible, but I am going to let him introduce himself for the record, for those of you that have never met him. He is fantastic. And then he will kind of give a broad overview, and then we'll allow some time for some questions, keeping in mind that we do have some other presentations coming up where there will be more specific detailed discussions about some of the agencies within the Department of Health and Human Services. So with that, I will turn this over to Director Whitley.
Thank you. Thank you, Chairperson Wynn and committee. My name is Richard Whitley, and I do serve as the Director for the Department of Health and Human Services. And I'm actually grateful that that the chair has allowed us to sort of break out in the future meetings some deeper dives into aspects of health and human services like Nevada Medicaid and behavioral health, and also a focus on the state's response to the COVID pandemic. I have a few slides, and they're really just to keep me on track. And I think if we start with slide 2, this references our department's authority and mission. We really have a population-based approach to healthcare and a public health approach to prevention and intervention. Slide 3 summarizes how the department is organized into 5 divisions. As shown in the gray boxes, they're framed around populations served, such as aging and disability services, child and family services, and functions such as public and behavioral health, welfare and supportive services, and Nevada Medicaid. Each of the divisions really comes equipped with all the standard bureaucratic components, personnel, information technology, and financing. Slide 4 represents the total number of full-time staff in the department. The DHHS employs over 6,000 employees, and the majority of the staff work in a direct service capacity. This session, there is a request for 288 additional staff, and this is primarily due to caseload growth in various programs, which really takes me to the next slide on page 5, the budget. So the cost, as the chairperson mentioned, for fiscal year 22-23, DHHS represents 48% of the state's total budget. And that represents all the funding sources, both the state general fund and federal match. But then within the DHHS budget, Medicaid represents 78% of the total amount spent. So you can see that DHHS has the largest spend of any single state agency, and that spend is primarily in Nevada Medicaid. Just in order to sort of frame the high level overview, if going back to slide 3, I'd like to spend a little bit of time talking about our structure. When you look at our programs, I think you have to look at them in the context of how we operationalize them in the community and what our role is. Our role includes like the direct delivery of service, the funding of service, and then the regulating or enforcement of service delivery. So we have all 3 of these components, and sometimes that exists in a single program. For example, in public health, we only have 2 local health districts in our state, Washoe County District Health Department and Southern Nevada District Health Department. The remainder of the state falls under DHHS for public health. We do have a Quad County collaborative led by Carson City, but that is not a health district. We're one of the few states in the nation that actually has this model where the state assumes some direct responsibilities for public health. Social services is really another area where there are county social services in every county, but they play very different roles. For example, in Clark and Washoe County, the child welfare is delivered at a county level, but for the remainder of the state has oversight for child welfare. Again, this makes for a challenge sometimes because the same oversight for direct service delivery is also oversight for the entire state. And so we are sometimes partners, but we're sometimes enforcement or regulatory in terms of a statewide system. This is also true in mental health. The state never really formally transitioned, as other states did, from state-operated mental health to county-operated mental health to community-operated mental health. Certainly not at the pace the rest of the nation did decades ago. Until the expansion of Medicaid, the state was the single largest provider of behavioral health services. And the transition to a more community-based strategy has really developed with the expansion of Medicaid and consumers having a choice on where they go to get services, and with the legislation that created the regional behavioral health boards. Before the expansion of Medicaid, we were really only one of 3 states who operated behavioral health in this manner, with the state being the primary care provider. Finally, I would mention that in Medicaid, this model is primarily a managed care model in Clark and Washoe County, and a fee-for-service model in rural Nevada. Additionally, there are populations such as the blind, aged, and disabled, which are in a fee-for-service environment. And so this service delivery approach is really complex, both in terms of, and costly, both in terms of the vulnerable populations that are served, as well as the actual financial cost for that delivery. For the past 4 or 5 years, we've really struggled while trying to reduce the number of people who are uninsured to really implement healthcare in an environment that really has been made difficult by the notion of repealing the Affordable Care Act and even impacting the expansion of Medicaid. It seems like as we moved forward to really mature our healthcare system, we had a lot of challenges along the way, further complicated during this past year with the COVID pandemic. But I think it's important to note that this was already a very fragile environment, the healthcare system in our state, due primarily to the fact that much of our state is a healthcare workforce shortage area, and access to primary care, specialty services, and even our health facilities such as long-term care and hospitals remain in some communities very vulnerable. During the pandemic, we have had challenges, but we've also had, I think, opportunities identified and maybe moved more quickly or took bigger or bolder steps to be responsive than maybe we would have otherwise. For example, and some of these things are too good to not build off of as we go forward. For example, telehealth has really increased access, especially in the area of behavioral health. and that's largely due to the groundwork that legislators did on framing telehealth. We were pretty much ready to go with the implementation, including with Medicaid. And so I'm really pleased that that has allowed us to continue with service provision during the pandemic. The other is the expansion of scope of practice. And a good example of that is pharmacists and pharmacy techs as immunizers. I think that a lot of focus in this workforce shortage area, and happy to share with you, or if you browse around on our website, you can see we have the Office of Primary Care, and it does the assessment that for the U.S. Department of Health and Human Services of those shortage areas. Those shortage areas then become vehicles for application for funding to become a federally qualified health center, or for healthcare workers for loan repayment. As I said, much of our state is a workforce shortage area as it relates to healthcare, but the challenge of producing more doctors and nurses, is just that, a challenge. But one area where I think we've seen some improvement in terms of just broadening the scope of practice of some of the existing disciplines. And so I'm hopeful that we sort of hold to the tension of those discussions, which are always tense when it comes to licensing boards and the scopes of practice. But I think that we have seen some benefit, especially in the area of vaccinators. The third area that I think that we've really seen an opportunity of growth in is with data analytics. And those of you that sit on the budget committee will note that one of the few moves that we're doing in our department this legislative session is the request to move data analytics under my office. Data analytics, much like financing, is usually categorical, and we have programs that have maybe come with a federal grant and have all the bells and whistles for data analytics. And then we have other programs that are largely reliant on state general fund that have very little in terms of capability for data analytics. I'm most proud of the work of Kyra Morgan, our state biostatistician. If you look on the website for the COVID tracker, and Nevada early on scored an A+ compared to other states with our transparency and data, largely due to the work of our state biostatistician and her team of staff. This really is, it's not just data for the sake of data, but it's really the analytics of the data that serves to really inform us. We have utilized that data daily as it relates to who's being tested, who's not being tested, with our health facilities where we are seeing outbreaks, and then where to target our limited resources. So I didn't want this to just be an event that occurred with COVID, but that this benefit of bringing the analytics together to be able to share some of those best practices, as well as the dashboarding, I think is really rich. I would just refer you all as legislators. One thing that Kyra did do is, if you go on the DHH website, on the main page, and you look on the right-hand side under Nevada Health Profiles, Kyra created a data dashboard by districts. So each of your legislative districts, you can pull up and look at the health indicators for the people that you represent, as well as the healthcare coverage, the uninsured rate or insured rate by what payer source, and demographics. I think it's a really rich tool. So that's one thing that has come out of the pandemic that I intend to keep pushing. It's really hard, and you've not seen, those of you that have served during previous sessions, we rarely ask for general fund related to data analytics because the service line is so long generally that our needs, we know where the need is. In behavioral health and substance abuse, we know where the need is. So the idea that we would pull resources for analytics, has been one that has just been too tough to really put forward. But I do think in this organizational structure, without costing any more money, we do have the ability to share the knowledge and the capabilities for data analytics. I also would mention that if you look, I had a great conversation earlier in the week with Joan Hall, who is the executive director for Nevada Rural Health Partners. That's the association of all the rural hospitals, most of which are critical access hospitals. And on her webpage, you need only look at the toolbox she created for data reporting of rural hospitals to just look at. I mean, I thought she deliberately created it to show the bureaucracy of it, but it really is a tool if you click on them to look so that new staff in hospitals know what they need to report. But what you don't see is, what do we do with all that data? How do we translate that to information that's actionable? And sometimes I'm really hopeful with this look at data analytics that I could come before you next session with some recommendations, perhaps on even changing some of the reporting requirements. There's a tendency that we do in government sometimes to sort of dogpile requirements on without pausing to take a look to see, like, does that still serve the same purpose, or are there really other ways of getting at the goal that was intended? And I think this is illustrated very clearly when it comes to data collection. And then what to do with it. If we collect it, I do believe that we should do something with it that would inform on strategies on how to either make improvements or go upstream and prevent a costly health outcome. So those are just a few of the things that I wanted to highlight that really are a silver lining and are needing to do work differently. Like the chairperson said, that you'll have a deeper dive into Medicaid. Our financing of Medicaid is historical, dependent on the counties, dependent upon the taxing. When we expanded it, we really didn't change the way we funded it. It's fragile. Those of you that were serving during the special session know that we initially came before the legislative body with some dramatic reductions, because as the economy could not continue to support the level of service, our limitations in Medicaid on what's essential and required versus what's optional, which if you have a need for that service, is not, from a practical sense, optional. So our financing of healthcare is fragile. We have opportunities with provider fees that are optional, but we haven't had any providers take advantage of that, other than what's required in statute for managed care paying a fee, and also skilled nursing facilities paying a fee. So there are opportunities in there. I feel as though our agency has had good momentum coming out of the last session, but have really had to focus. It's been all hands on deck, really, related to the COVID pandemic. One other highlight I think I would be remiss if I didn't mention is our oversight of healthcare. If you've been around a really long time, like the last decade, you know that Nevada had the largest exposure to hepatitis C in a health facility, in an ambulatory surgery center in Las Vegas. And it's been 10 years. But one of the things that happened out of that horrible event was that we embedded facility epidemiologists, disease investigators, into our regulatory agency, healthcare quality and compliance. I'm very proud of the work that Margot Chappell and Lisa Sherrick have done for ensuring that our health facilities are safe. We have had tragedies, we've had deaths, but certainly when you look at at Nevada compared to other states, we rank amongst the lowest. We're responsive when there is an outbreak, whether that's employee training, lack of equipment, policy. We are quick to get in, identify the problem, and find solutions. I'm very proud of our regulatory environment in that it isn't regulatory in isolation. It's regulatory that enters from the belief that we share the same goal to be compliant. And I really have not seen other states who operate in this way. And frankly, not even the feds, with CMS breaks out the regulatory arm and operates really in a silo. And I'm quite proud, and it was demonstrated once again on the effectiveness of the work with our regulators, with really keeping our most vulnerable protected in health facilities. My final slide is on page 6, and that really just lists out the bill drafts from our department that will, for the most part, be appearing before you in this committee. And that concludes my formal presentation. I was trying not to read my presentation, but to speak to it, and as asked. And I'm really happy to answer any questions. And I will tell you if I think that I need to have someone else provide additional information, I'd be happy to get back to you. Also happy to talk with any of you that have bills. As you see in our organizational chart, we have touch points to a vast variety of financing healthcare, regulating it, and delivering it to all populations. And if you have an intention, what usually happens with the legislature, my experience is that a great idea until it gets a fiscal note, and then the fiscal note becomes the stall, really. And sometimes what I find when we reach out to legislators and try to talk to them about what they're trying to do, the program or what their intention is, it's not in the context of maybe something we already have. So I can't keep myself from doing that. If you have an interest in an area that would help people, and we have a piece of the program or the components of it, and could work together. So with that, I'll end my presentation, and I'd be happy to answer any questions.
Thank you, Director Whitley. It was a wonderful presentation, as you always do. Assemblywoman Titus had mentioned that you're so good at these presentations, and she also mentioned that you have amazing historical data. You've been in this position for a while, and reaching out to you, I know that we put a lot on your plate, but I appreciate your willingness to be able to make healthcare affordable. I know one of the philosophies that I have in life, and also up here at the legislature, is that if there's a problem, does the bill actually solve that problem? And I think it is very important what you said, is sometimes there are already solutions out there. Sometimes there are already laws out there. Sometimes there are already programs out there. And so that kind of follows me up with the first question that I kind of have for you. And on that chart, on that organizational chart, you show those 5 main divisions of DHHS. And I know that we always focus on specific to healthcare services, but can you touch a little bit more on the other social services that are managed through DHHS, and how many different programs there are within those 5 main divisions?
Sure. Again, for the record, Richard Whitley. I think starting with one that I think doesn't get a lot of focus is welfare and supportive services. That really is the eligibility engine for multiple services. And I would have to say that, well, first of all, a shout out to the staff that work in that program, mostly frontline eligibility workers, some of who were consumers of services, and Administrator Fisher has created a pipeline for opportunity for people who may be recipients of some of the services to actually become employees. But I'm very proud of the work that they do in eligibility. There's a poet named May Sarton who had a statement that to be rich is to have a margin to give. So anybody can be rich if they have a margin to give. And what the welfare division provided staffing to Dieter with some of their struggles with the application process. And the reason for this is that welfare and supportive services have an integrated model for their eligibility. So it's really an engine that populates whether it's Medicaid, which I think people think automatically about a service, but supplemental nutrition assistance program, SNAP, or what used to be called food stamps, and temporary assistance for needy families. Those are all programs. They have different financial eligibilities. TANF has the lowest eligibility, about 100% of poverty. You have to really be living in an impoverished way in order to qualify for that direct assistance. It's interesting that during the pandemic, we've actually seen the caseload in that program go down. It's actually lower than what was projected during the last legislative session. But in programs like Medicaid and SNAP, we have an increase in the eligibility. But I think what's most from a government standpoint, I think what's most important about this work is how they do it. They do it with a single electronic application, so that if people are eligible for other programs, there are prompts to actually complete the application, so they don't have to get in multiple lines. And I would say the other thing that with welfare and supportive services is they went through a lean process for and have it's much more than a motto, but it's called one and done. So when a consumer approaches them with a need, their eligibility staff are able to help them meet their need with their application and complete the service. Prior to this, if you wanted to apply for a categorical program, you had to get in a categorical line. If there were errors, you had to start over again. And I really would hold this up as an efficiency in government that many of my other programs and other departments could benefit from looking at. Anyway, the food security, food and nutrition as a determinant of health, I think that the welfare and supportive services has a touch in that area through the SNAP program, as well as our WIC program, Women, Infant, and Children. Food security during the pandemic has become, I think, a real focus area for people that have never had to access these sorts of supports in the past. And so a lot of assistance with navigating how to get access, and then also to remove some of the stigma that with older Nevadans who maybe don't probably if I had a do-over, I would change the title of welfare and supportive services. The title of welfare puts some elderly or senior folks off in terms of accessing services like food. Senior Meals, which is operated in aging and disability, so Meals on Wheels, we certainly has become even more important with senior centers closing because of risk and more meals being delivered. I would say that our major partners in that program, Catholic Charities of Southern Nevada, really expanded their provision of in-home food delivery. We also, I think, during the pandemic with other food delivery, what's been really helpful is getting some waivers so that people could get food delivered. I mean, if you can imagine a single mom on WIC, and if we, on the public health side, we ask the mom to stay at home because of COVID, but yet her children need access to food. So we have had waivers approved by the feds to be able to have delivery as well as pickup for some of our food programs, which I would also add helps our economy in terms of the retail and the ability to make sales. And so I think those programs, I think in terms of food security, run across our divisions, but definitely work together. You might have one family, they get the grandmother may be living with them, and they may have young kids, and they may qualify for multiple programs. We work across our divisions to really organize that and make sure that there are prompts for eligibility to any of the programs. But food security has become more of a focus. Food and housing probably are the two areas where people reach out with the greatest vulnerability. Just on that note about the application and enrollment, I would say that, and I guess this makes sense when you think about it. Although I kept waiting to see when our enrollment in Medicaid would spike really, but it's really been more of a gradual increase of enrollment. And just in talking with people that do enroll, their health care is not their primary need, because if you think about it, they're likely not disabled. They've been working, they get laid off. And so it's only when healthcare becomes a need that they've been enrolling some of the folks that have been laid off. So that's been a gradual increase. But SNAP, we've seen more of a spike in application. So I illustrate across divisions, some programs beyond healthcare, but I would call these all determinants of health. I mean, poverty certainly is a determinant of health, housing, food security, and then behavioral health. We've seen, I think we've also been enriched by our working relationship with the schools. So proud of the relationship with the superintendent of education and the reach out to the school districts on how to meet some of the behavioral health challenges with kids that are homeschooling and perhaps need additional help. Same goes for victims of crime and some of the services that people are needing in that area. So I would venture to say that if it's a social service program, we have a touch point to it. Certainly in all these areas, we look for parity of service. So if we're underserving a population or there's overrepresentation, to be able to look to see what's going on, to see if we could go upstream and address the problem. We do have in our state a lot of food deserts. We have areas in the urban areas, even where it's one of the maybe flaw is too strong of a word, but I think it's one of the weaknesses in the USDA programs like SNAP, in that a liquor store could put some groceries in and qualify to be a SNAP provider, but that might be the only source for retail purchase of food in a neighborhood. And so I have identified that as an area that we could improve on the food desert. There are some models in WIC that I've found, like in Chicago, they actually have mobile WIC stores that go to neighborhoods. And so we've had some meetings with Catholic Charities about opportunities in that area. But just want to come full circle and say food security probably is a pressing topic right now, from the food pantries to these categorical programs that school lunch programs, WIC, SNAP, that really in combination serve families.
Well, thank you, Director Whitley. I appreciate that. I think what I appreciate most about you is your ability to kind of see some of the challenges that we've had with this pandemic and using it as an opportunity to streamline and cut through some of the bureaucratic red tape that we have for getting these services out to the individuals that need them. So I appreciate your willingness to be flexible, streamline, the access to services, and your willingness to come and share this. I don't know if anyone has any other questions. I didn't get any in the chat. Does anyone have any other questions for Director Whitley while we're here? Like I said, he is a resource. I think we put the information to contact DHHS and the different various divisions and agencies. We will get that to you if it's not in the chat, and we can probably, I think it's available on Analyst as well. And we will see you probably again throughout the session, Director Whitley. In fact, you'll probably get sick of seeing all of us in these little boxes. And hopefully in the future, we'll see you in person as well. But does anyone have any other questions? I don't see anything here. So I'm going to take just a short, 1 minute break. Actually, I don't know if we need to, it looks like, and move on to public comment. As a reminder, you can always provide public comment in writing and provide that to the committee secretary. And I think we have one person in the public comment queue. If you could clearly state your name and spell your name for the record, and I would like to limit our comments to 2 minutes. Typically, I would limit the public comment at the end of the meeting to 30 minutes, but it doesn't obviously look like that's going to be a problem. So I will turn this over to BPS if there's one person in the queue.
I'm sorry, Madam Chair, I couldn't get my thing to work. There are actually no callers in the queue, and the public line is open and working.
Okay. Well, with that, then, are there any other comments from the members before we adjourn?
If I might, Madam Chair?
Yes, go ahead. Assemblywoman Titus.
So thank you for that, and thank you for the presentation from Director Whitley. I will tell you, per our conversation, the institutional knowledge that he has to offer and how did we get here and what brought us here is quite a value to all of us, and would encourage you, as you have already mentioned, to reach out to him, and if he doesn't know, somebody in his department will know, and because sometimes just getting the history so we don't have to repeat that, and some of these programs that may or may not have worked, and I think it's a big lift for the state of Nevada. As you already mentioned, it's over a significant portion of it's our biggest budget item is healthcare, and so I think that we need to really understand where we send that monies, and so I think Director Whitley is a great resource.
I completely agree. Any other comments or concerns? I don't see anything here, so that concludes our meeting for today. We will not be having a meeting on Friday afternoon, so our next meeting is scheduled for Monday, February 8th at 1:30 p.m. We have several more detailed presentations, still no bill draft requests or bills that we will be hearing at that time. And that's kind of it. That meeting adjourned.